we present our work Understanding Barriers and Design Opportunities to Improve Healthcare and Quality of Life for Older Adults Through Voice Assistance. This is a collaborative effort among Computer Science and Engineering, Qualcomm Institute, Biological Sciences, Cognitive Science, and the School of Medicine at UC San Diego. According to the United Nations, aging has become an important global issue in the 21st century. In the United States, by 2034, it will be the first time when older adults are projected to outnumber children. As a result, finding ways to enhance healthcare and quality of life for older adults is more important than ever. Today's information technologies are promising to improve healthcare, management, and quality of life. However, accessing them will not be straightforward for aging individuals. Conversational intelligent virtual assistants enable new ways to naturally interact with the digital system. However, the practical needs, challenges, and design opportunities to integrate conversational voice assistants into everyday life of older adults is still underexplored. To solve this problem, we focus our research on healthcare delivery for older adults in terms of collaborative tasks between patients and providers. We conducted semi-structured interviews with 16 individuals ages 68 to 90 years old, as well as 5 healthcare providers composed of 2 geriatricians and 3 nurses from our UC San Diego health system. With older adults, we discussed the themes including daily routine, potential ways to manage prescriptions and health information, as well as opinions regarding voice-based intelligence virtual assistants and other voice-based technologies. With healthcare providers, we talked about the themes, including healthcare expectations, perceptions of technology, benefits, and feasibility of adoption, as well as patient-doctor communications. By analyzing qualitative data from both patients and providers, we found barriers spanning 4 areas which older adults might encounter during daily life and while managing their health. These 4 areas include improved ways to manage, track, and seek information regarding prescription and over-the-counter medications, lack of companionships and advising of healthy and unhealthy lifestyles, lack of efficient ways to report health data, supporting routine check-ins and use of graphic user interface in patient portals such as MyChart for keeping track of appointment and communicating with their healthcare providers, setbacks related to current voice-based technologies, including the technology complexities and glitches, frustrations caused by hearing impairments and poor performance of speech recognition, as well as privacy and security-related concerns. Overall, we identified design opportunities in terms of 3 aspects. First, we offer design recommendations for health in terms of support to access and manage health data. By examining the functions and features that older adults want to use and have already used, we found that medical and healthcare related tasks are what older adults expect to have. For example, while reporting health data, older adults still prefer to stick to the more traditional approaches, such as using the pen and paper, to record data and send to providers through an electronic health record. For example,
like I have to weigh myself every day and take my blood pressure and my sugar and keeping all that down. And my friend said that would be a great thing for me to be able to have Alexa keep that information and then just be able to transfer it to my chart, instead of me having to type it all in for the doctors.
Our results show the importance of integrating voice into 2 kinds of tasks. The first tasks are those that happen periodically, such as the medication reminders, and the tasks that do not require older adults to spend significant amount of effort, such as the ecological momentary assessment and health data reporting. Second, we highlighted the importance of supporting ubiquitous connections to the environment through voice, which we call the design for environment. First, both patients and providers agree that it is important to monitor situations that might cause life-threatening danger and initiate appropriate warnings as well as guidance. Beyond this, providers also highlight the importance of advice on reducing unhealthy lifestyle choices. For example, one nurse pointed out that some older adults may inadvertently drink alcohol in excess without consideration of their respective health conditions, leading to an emergency room visit. It would be more useful if there were some ways to give instantaneous guidance or advice. She said,
So sometimes, like congestive heart failure patients, you don't want them to drink. But in general, a lot, what I've noticed is older adults, it's a trend that it's either like they forget to drink,
Mm-hmm.
or they just don't think about it, or they're not hungry, or so a lot of ER visits happen because of dehydration.
However, integrating sensors and actuators might introduce additional challenges on the ease of use, especially during setup and troubleshooting phases. The final opportunities we identified are what we have termed design for ability. In our study, while all patients can live independently or semi-independently, they all have more than one medical condition or comorbidity. The top two conditions are cardiovascular and musculoskeletal disorders. While designing features on voice-based conversational virtual assistants, we recommend the use of ability-based design as a framework to focus on the older adults' ability instead of disability. However, due to the invasive nature of audio data and the corresponding privacy concerns, we added privacy and trust as an additional category. To summarize, we present findings from our analysis of conversational intelligent virtual assistants for older adults, which aims to improve quality of life and healthcare management. From semi-structured interviews of 16 patients and 5 providers, we generated 12 barriers and design challenges, as well as opportunities across 3 areas. We believe our work will benefit future researchers and practitioners aiming to create fully fledged voice-based intelligent virtual assistant software-hardware applications and to integrate them into existing healthcare ecosystems. We hope you enjoy our work, and for more detail, please refer to our paper.